Now that I have applied my hand hygiene and I just applied my gloves, I'm now ready to enter the patient's room. I'm going to ask the patient 2 forms of ID, name and date of birth, and make sure they don't have any allergies. I'm going to inform the patient that they're getting Rocephin for their infection, which is an antibiotic. At this time, I'm going to go ahead and inspect the patient's IV site, check for any signs of infection. There's no bloodness or infiltration. I then am going to use alcohol swab for my aseptic technique on each end, and I'm going to connect. And once I connect, I'm going to aspirate blood. I have a blood return, so I'm going to go ahead and do the push stop of 3 mLs, and I'm going to do half an cc at a time. I'm going to do the push stop method with flushing of the normal saline. Alright, now that I have reached that, I'm going to take out my syringe, and I'm now going to attach my medication. I'm going to go ahead and alcohol swab again there, and as well as the end of the tubing line, which is going to be connected. Now that I have going to connect the medication, and now I could unclamp the connector and the tubing line. At this time, I'm now going to check my drip factor, which I had stated earlier that it was going to be 17 drops per minute. As I just adjust the drop factor, I'm just going to release the clamp and count for a minute to make sure the drip's coming out as needed for the drops prescribed. Once I know that's okay, I could go ahead and leave that until the medication is finished. And then it would come back to disconnect the medication once it's finished. At this time, I would come back in, perform my hand hygiene, and apply my gloves. I now would clamp the connector tube, the tubing line, and then I'd remove the empty medication, and I would recap anything that is open. I then would go ahead and disconnect the tube at the IV insertion site, and I would get the rest of the 3 mLs of saline and alcohol swab with the aseptic technique on each end, and I would go ahead and do the push stop for the rest of the 3 mLs of normal saline from the 6 that I've started. Once that's done, I could go ahead and use that. I'm going to now inspect and document my IV site, the time, my date, initials, the medication which I administered, the route, and I would also use my MAR, and I would record the input and output.